Hi, my name is Julia, and I'm the full trichologist. And today I'd like to introduce you to somebody very special. This is Valerie. Valerie is our patient here. She underwent the platelet-rich plasma procedure, better known as PRP. And now that she's completed her treatment, I'd like Valerie to talk to you about her experience and tell you a little bit about her story.
Okay, so as you know, a little over a year ago, I was on a medication which triggered significant hair loss for me. It started out somewhat slowly, but then increased to devastating amounts. And even when I stopped the medication, the hair loss did not stop. I was frightened. I was very stressed out. I was very concerned, obviously. I didn't know if this would ever stop, and I really, at that time, wasn't sure what to do to take care of it, to get my hair back, and to stop this process. So fortunately, we came across the platelet-rich plasma therapy, and it made a significant difference for me. But before I got to that point, as I said, I was just losing just a tremendous amount of hair. Hair was coming out, losing hair in the shower, losing hair when I was brushing.
I remember.
Losing hair just throughout the day. I mean, I would just look down and strands of hair were on my clothing. Frightening, very frightening. Especially after a lifetime of having long, thick hair. So, I mean, hair really is just, it's part of my identity, like it is, I'm sure, for most women.
You lost quite a bit of it, huh?
I did. I really did. I would say I probably lost close to a third of my hair. So it went from long and lush and full to thin and scraggly. And I was trying to still keep it long, but it just really didn't look good. I didn't want photos taken of me. I'm normally a very confident, happy, positive person, but this was really affecting me. It really was. So, as I said, even after I stopped the medication, the hair loss did not stop. I was fortunate enough to come across the platelet-rich plasma therapy and started the PRP treatments, and they have just made a significant difference for me. I am so much happier. So much stress has melted away. I love having photographs taken again. I mean, it's made such a difference. I can't even put it into words, in all honesty.
You look beautiful. Your hair looks gorgeous.
Oh, thank you. Thank you. Yeah. I just, and not only do I feel so much better, so much happier, and more confident again because of the regrowth of my hair. So it wasn't until I started the PRP that I really felt a difference and saw a difference, not only in new growth of hair or regrowth of hair, but also in thickness and just the diameter.
Density throughout.
Yeah.
Growth, density, just the quality, all of it.
It's just,
you look,
I'm
you look
thrilled.
amazing. There really is no comparison. I mean, you've always been beautiful, but with the regrowth of your hair, I mean, it just made it's just stunning. And I am just so happy that you're here. It's been a pleasure having you over the last year. Come in and do these treatments, and again,
Thank you.
I'm so happy for you.
I'm thrilled. I really am. I have all of my hair back. When I had reached a point where, like I said, I had lost probably close to a third of it, and I didn't know if it would ever stop. I didn't know if I could literally lose all my hair, and
well,
that was scary.
We got it back.
We got it
you
back.
Look amazing, and
it's thick. It's full. I'm thrilled, and there are some things in life that we can't help but worry about. Things we have to worry about, but losing your hair, particularly for a woman, shouldn't be one of them. So I'm very excited
well, it doesn't
that we
have to
found
be.
you.
So
Yeah,
thank you for being here today.
no longer is. Thank you.
Hair loss is an embarrassing issue for anyone, but when you're hosting a daily television show, it can be a real problem.
Dr. Ashton is here for a PRP, platelet-rich plasma treatment of injections into her scalp for her hair loss.
A month ago, I had my first treatment. I'm here for my second treatment. I looked like a balding man, and it was really starting to bother me. What's involved in the PRP treatment?
We get some blood drawn. We draw up the platelet-rich plasma. We will put some numbing cream on your hair before you start, and then we'll inject the PRP into the areas where you've lost the hair. I'm going to do the frontal hairline, do the couple areas that she wants to do, and I'm also going to do the hairline.
We're joined by Dr. Jeffrey Rappaport and, of course, our very own Dr. Jennifer Ashton. First of all, thank you for opening up about this.
Well, listen, I know that this affects a lot of people. I hear this from women all the time. Obviously, men deal with losing hair and thinning hair, but it really is upsetting for women. And I was like the first in line pretty much to try this new treatment.
Ask the good doctor,
yes.
Are you happy so far?
Oh, it was incredible. I've done 4 treatments. I saw an improvement in this area and this area, which was really where I mean, look at that. You could see right to my scalp. I started to see a difference in 2 weeks. Now it's been about 4.5 months, and I see a huge improvement.
So let's talk
Dr.
about
Rappaport.
PRP, right?
Yeah,
It's
so
used for so many things.
Platelet-rich
Plasma. Yes.
How is it helping in hair loss?
Well, the plasma has a lot of platelets in it, and the platelets have growth factors. There are about 7 growth factors in the platelets, and what that does is 3 things. 1, recruits new hairs to grow. Number 2, keeps hairs that are there growing, and most importantly, stimulates the stem cells that are around the follicles to get thicker. So that reverses the miniaturization of the follicles.
So really different than any other technique that we've used in the past.
Well, in the past, there's been surgical technique, as you're well aware of, and then there's the non-surgical technique, but there really hasn't been a game-changing technique like this where we can see results that are really quite substantial. The study in the key journal Dermatologic Surgery showed that 62 out of 64 people got positive results. It's not going to be so easy to find people who are doing this type of treatment.
Yeah.
You want to know what's funny? When we talked about studies, you know how you know a study has been done and a really good one? It's when Dr. Ashton gets the treatment. Because this one here, she knows her medical research. Sounds like this really is going to be one of those game changers because a lot of people have thinning hair and a lot of people don't want thinning hair. I'll tell you, hopefully coming somewhere near you. We'll, of course, have more information on our website, thedoctorstv.com.
Thank you.
Thanks for taking such good care of Jen. And Jen, you do look fabulous, if I may say. We'll be right back.
Millions of men and women suffer from hair loss, and for these men and women, their alopecia is not a trivial or a vanity issue.
I had struggled with hair loss since I was 32 years old. Coming from a family of physicians, I tried all of the latest prescription drugs for hair loss, but none of them have worked for me. With my PhD in biomedical engineering, and as a former NASA scientist, I knew there had to be a better solution that allowed me to rid myself of medications and regain my hair using technology. It was at this early stage of development that I met Ghazal.
One day, shortly after my 15th birthday, I was brushing my hair and I saw an unusual amount of it coming out. My hair means a lot to me, so naturally, I tried everything out there, but nothing seemed to work, and I had no hope left of feeling normal again.
After discovering how many people were like me and Ghazal, unable to find a solution that worked for them, I decided to dedicate my skills and expertise to create the best home hair restoration and hair health device. Following my goal of bringing in clinical strength technologies directly to people who need it, the Theradome LH80 is the result of our efforts to solve this problem.
The Theradome LH80 uses a proprietary full scalp helmet design with 80 laser diodes to emit light energy at the optimal wavelength for hair growth. This light energy is absorbed by the hair follicles, stimulating cell metabolism and increasing blood flow. This process creates the optimal environment for the scalp for hair to grow thicker and fuller. Theradome and in-office clinical grade devices are effectively identical in power, type of light, wavelength, and concentration. The only distinctions are price and home use.
Because of our partnership with a world-renowned Modulus medical device manufacturing facility right here in Silicon Valley, we're able to take this cutting-edge technology out of the clinic and into the home.
Through the efficacy study of the Theradome LH80, it was found that in as little as 1 month, 98% of the participants who were battling hair loss experienced positive visual results, and within 4 months experienced new hair growth. Equally as important was that it was also found to promote overall hair health. Participants often experiencing a doubling of the diameter of the hair shaft and 99% experiencing visible hair thickening.
It was only by luck that I was one of the first few participants to try out the Theradome helmet, and I'm really glad I was. I would recommend it to everyone. Thanks to the Theradome helmet, I now have the kind of luscious, full hair that every 17-year-old should have. If your hair is thinning, or if you want better, fuller hair, or if you're losing hair, you should definitely try the Theradome helmet. It gave me back my confidence, and it changed my life. It can change yours too.
It is my goal to make these same results possible for everyone, young and old, by providing people with the benefits of using the Theradome LH80. Together, we can make hair loss a thing of the past.
Initially, the way I felt when I realized I was losing my hair is, what? How is this possible? I didn't think I would ever lose my hair. I didn't want to look in the mirror anymore. Before, I avoided the mirror. To brush my teeth, I would just do my thing, gargle, blah, blah, blah. I'd look for 1 second and just put the hat on. I didn't want to own up to it. I didn't want to face what was happening to me. I heard about Theradome, and the thing about Theradome, it's the technology that I truly believe in. It just made sense to me. It clicked with me. I was hesitant, excited, nervous, but still kind of on the fence about, is it gonna really work for me or not? After my first session, I said, harmless, easy, peasy, and when's my next one? I started seeing results probably I'd say into the second month. Results as in seeing results, as in looking in the mirror and saying, hey, wait a minute, there's a little bit of thickness there. And my hair is a little less brittle. It has built my confidence where I was almost ashamed I was balding. Now it's almost like it was hey, your hair's coming back, just kind of own it and show it off. Theradome works. This process works. This therapy works. It's been a wonderful friend for me, Theradome. It's helped me tremendously.
When I was modeling, my hair had to look good, and I would try anything and everything to make sure it did. And some things we used to style my hair to make it look fuller and thicker actually was ruining my hair. You have the power to change your hair. You have the power to make it happen. You have the power to have healthy hair. There's a solution, a really easy one that works. It's called Viviscal.
Viviscal is the only hair growth supplement that contains the proprietary marine complex ingredient Aminomar. In addition, we have fortified our formula with biotin, zinc, vitamin C, and horsetail plant extract.
Billions of dollars are spent on hair loss treatments in America every year. Unfortunately, a lot of them don't work. So any price you pay for something that doesn't work is way too much money. But something like Viviscal that works, that's easy to take, is 100% drug-free, is priceless.
When I hit menopause around age 51, then I started noticing more and more as the years went by, more thinning, more loss of hair. You don't realize how much it affects your everyday life, but it does. And you find that that you don't want to go out, because you show the thinning areas in your temples or your crown. So I started using Viviscal, and I love it. It's hard to describe that moment that you see the hair grow back. Just to have my self-confidence back, it's priceless.
sort of our fix anything kind of a show. We've brought in pros, and they're going to help us all get the lowdown on decor. They're going to fix some DIY dilemmas. First up, we're going to try and fix an issue that women especially do not like to talk about, and we certainly don't know how to fix it. Female hair loss. The truth is 50% of women experience some form of hair loss. Here to help us understand why it happens to women and what we can do about it is Dr. Doris Deck. That's her name. I have friends, a friend that's very close to me, as a matter of fact, who struggles with this. And for women, when you're talking about hair loss, I mean, we all know that men are obsessed with it. Heads up, guys, it doesn't matter if you're bald or you have lots of hair. Just own it. The stick-on stuff is not the solution. But no matter how obsessed men are with this, I think for women it can be even more traumatic and dramatic to them because they associate long, voluptuous hair with their femininity, Women get really frightened if they start to suffer hair loss.
You're absolutely right. And when you have beautiful flowing hair, you actually feel sexy. It's the first thing people say and see about you, and it can take years off your looks if you have the right style, the right color, and lots of hair. But for so many women, really as many as men, nearly 40 million women suffer from hair loss, and sometimes it's their worst kept secret. They don't tell their best friends, they won't go on dates or job interviews, or they'll do things where they can't take their hair off when they go out, so they almost feel like imposters or not like a real version of themselves, and it can become all-consuming. I have women who come in with bags of hair to show me how much hair is falling out every day, and they obsess over all the underlying causes, most of which really will have nothing to do with it. But there's so much that we know, and I'm here to tell you that you're not alone if you're going through this, and there is so much to be hopeful about. There are supplements that you can take. So I tend to be holistic where I can. Sometimes we balance women out hormonally, but there are things like Viviscal. And Viviscal is available at your drugstore, and I'm a big drugstore girl too when I can be. And this contains a fish protein, it's not a fish oil, it's a fish protein, and also silica and vitamin C.
This I've read a ton about. Celebrities use this, and you read about it in ads and beauty columns.
Exactly.
And now
it has a cult
can
following.
men use that as well?
Yes, this is for women and for men. They're actually coming out with a version specifically for men, but both women and men can take this. Now, there's so much hype. We have a very vulnerable audience when we have people with hair loss, and they will do anything, and they get sold sometimes such nonsense. So I'm always looking for clinical data and science behind the products and the treatments that I recommend. So Viviscal is great that way, and I'm very satisfied with the data and with the difference I see in my patients.
So we wanted to help out a woman who's been struggling with hair loss for years. Her name is Maureen. We set you guys up together, right? And we've been following you for what, about 6 weeks?
Right, which is early. 6 weeks is exactly when we start to see the difference.
But see, that's even surprising to me that you can make progress, like visible progress, in as little as 6 weeks.
Exactly.
Because if you've struggled with something that you're self-conscious about and it's been years, 6 weeks goes like that.
That's true, and there's that hope.
Wow, look at the before and after. There seems like a very substantive difference there.
Absolutely, and she's just beginning.
So, Maureen, what do you think?
Well, I have had the best experience. I'm so encouraged. I've been getting compliments. It's been easy. I take my Viviscal like I'm brushing my teeth. It's twice a day. All the treatments have been easy, and I'm really hopeful because it's feeling better. My hair feels better.
Probably lost close to a third of my hair. It went from long and lush and full to thin and scraggly. I didn't want photos taken of me. I'm normally a very confident, happy, positive person, but this was really affecting me. It really was. Even after I stopped the medication, the hair loss did not stop. I was fortunate enough to come across the platelet-rich plasma therapy and started the PRP treatments, and they have just made a significant difference for me. I am so much happier. So much stress has melted away. I love having photographs taken again. It's made such a difference. I can't even put it into words, in all honesty. There are some things in life that we can't help but worry about, things we have to worry about. But losing your hair, particularly for a woman, shouldn't be one